Hi, I'm Tarryl Clark, the State Senator from St. Cloud and the Senate Assistant Majority Leader. Welcome to another edition of The Update. The Senate just voted on the Health and Human Services budget, and like every other area of the budget, we just passed a number of cuts that nobody wanted to vote for, cuts that we prefer not to have to do. But in this historic budget deficit, $6.4 billion deficit, it's an area like every other one that needs to be having some reductions. The Senate budget over the long run reduces health care costs by 7%, but keeps us on the path of health reform, which ought to help all of us with our health insurance and make sure that people who are disabled and seniors are able to remain as independent as possible, and make sure that people who are working who can't get insurance through their job still have a way to purchase insurance. There's a lot of things that are good about this even in these tough times, but it's still a 7% cut. The governor's proposal, on the other hand, was voted down today. His proposal would have cut health care now at about 12%, but over the course of the next few years, it would have cut about 33%. And what that means is a pretty stark contrast. It meant that he would have gotten rid of health insurance for about 113,000 Minnesotans, dental coverage for about 300,000 Minnesotans, hospital coverage for 30,000. It would have been a loss of over about 10,500 private sector jobs. It would have meant that doctors and other health providers would have been having to still pay the provider's tax, but the money wouldn't have been going for health care necessarily. It would have been going to pay for the budget deficit, money that is targeted specifically and solely for health care. So the contrast couldn't be larger. The Senate voted it down in lopsided numbers, and I think that's because people knew that you can't make that many cuts. We have a lot of people who are obviously growing older, each of us are every day, but we have a growing senior population. We also have many people who are disabled who are able to live fairly independently and are also living older. Those are the two populations that have the highest growing health care costs in our state. And we're trying to figure out together with them and their families how we can make sure we can provide services but also contain costs. But eliminating health care isn't the way to do it. So together we need to find a better way. The cuts that we made today are going to still leave adequate funding. It's going to be hard, but they will help us build a foundation for the future along with the other cuts that the Senate has made and along with finding some new revenue. And once we all get through this economy in these hard times, we can have a better future together. But we've worked hard to make sure that protecting those who are hardest hit by the recession was able to happen. I'm Tarryl Clark. If you have thoughts or ideas about how we can make a difference entering into the negotiations with the governor and the House, please let us know at www.senate.mn.